and how that ought to drive everybody's concern. And they talk about all kinds of things to do about the deficit. This data suggests that there's only one thing to do about the deficit. If you look at federal non-interest spending, it's flat, going on into the future ad nauseum. If you look at revenue growth, it's a little bit up, not flat, but not very steep. So they're anticipating revenues to the federal government rising gradually on into the future. Social Security is flat. Even though us baby boomers are getting eligible for Social Security, and everybody talks about how that's a crisis looming, it's actually gradually going up with the baby boom right there, and then it's flattening out on indefinitely into the future. With rising federal revenues slightly, that's actually not a problem. What is a problem? It's this. Look at that. Medicare and Medicaid principally federally funded, Medicare 100% federally funded, Medicaid mostly federally funded, rising astronomically. The federal deficit is a healthcare problem. It's not a problem of anything else. Healthcare only. You solve the cost problem like Dr. Emanuel suggests, and you solve the federal deficit. I guarantee you something. Things that can't happen won't. And you cannot have a nation that's $60 trillion in debt. That's the nation that you're going to have when you become Medicare eligible. It ain't happening. You're not going to have Medicare at that point. It just is not going to go. We have to fix this, or, I'll enjoy my Medicare and too bad for you. So, I don't mean to just leave you hanging out there with this cost problem and think, doom, gloom, terrible, we're never going to do anything. This slide actually suggests the way out. It helps you understand, I think, why it is that we can have such poor quality and such high cost. Aren't you used to thinking of you pay more, you get better quality? That's certainly what our politicians sell us if they ever do talk about high cost of healthcare. They usually say it this way. Yes, it costs a lot in the United States, but doesn't it cost a lot to be the best? We have the best healthcare system in the world. So naturally it costs more. You want to buy a car, you want to buy a Cadillac, or you want to buy a Yugo? Do people still buy Yugos? Oh, sorry, those are gone. Okay, what's the cheapest car out there right now? Whatever that is. You spend less when you don't get the higher quality product. And we get, the saying goes, we get the higher quality product. Well, guess what? That is not true. Here's data from Medicare that the authors looked for quality indicators. They graded every state. These little dots are those are 50 dots, they're 50 states. There's Utah right there, for instance. They graded each state by quality. They looked at charts, Medicare charts, to see if the proper quality parameters were fulfilled in each chart. And they graded overall a whole state based on this. And then they also looked at the per capita cost. Again, this is Medicare spending in dollars. So you can see they've got the scatter graph up there. And there's a correlation, which is represented by this line. But it's a reverse correlation, which means that the better your quality, the lower your cost. This is a very important principle. In a market, higher quality products cost more. But healthcare, when it's higher quality, actually costs less. That's our way out. We have a terrible system in terms of quality and efficiency. And if we could only reform it so that it would be a higher quality system and more efficient, we would have lower costs and we could save a lot of that $3 trillion a year. And when you begin to be able to save $1 trillion a year, you start to see how you can work away against that $60 trillion future federal debt. All right, so let's talk about how this might go.